DRSABCD method. It's an amazing technique that is used when you're approaching an emergency situation where you believe someone has gone through sudden cardiac arrest. So how do you do this technique? The first step is D, danger. Before approaching the victim, you should first assess your surroundings to make sure that you and the people around you are safe. So what should you look for? You should look for sharp objects, any exposed electrical currents or wires, or any strange liquids, or anything that really seems or looks like it caused the person to collapse like this. Because if you cannot make sure that you and the people around you are safe, how will you be able to help save another life? Right? So that leads me to the next step. After making sure that you are safe, you can go check to see if the person that has fallen down is responsive. Because what if they're actually just sleeping and you're just panicking for no reason? You want to make sure that is not the case. So you need to try to wake this person up. So how do you do that? You want to locate the shoulders of the person's body, and then the shoulders are right here. You want to tap down on this area. And how do you want to tap, and what do you want to say? You want to tap on the shoulders and say, "Are you okay?" I'll demonstrate like this. Are you okay? Are you okay? And after doing so for a while, until you feel satisfied that you've tried to wake this person up, and they're showing no signs of responsiveness, then something is definitely wrong with this person. That leads me to the next step, which is S, sending for help. In my situation, I can take Dhruvan as an example. I have Dhruvan with me. So I would say, Dhruvan, dial 108 and call emergency services and get me an AED. Afterwards, I want to then proceed with the steps of assessing this person and continue until Dhruvan comes to get me an AED and the ambulance arrives. So after sending for help, the first thing you want to do is to make sure that the airway is straight and the person is able to breathe. So how do you make sure that the airway is straight? You want to take one hand, place it on the forehead, take another hand, place it under the chin, and while you're pressing down on the forehead, you want to lift up on the chin, like this. I'll show it to the side too. Like that. And when you're doing that, the airway becomes straight instead of being diagonal. So the windpipe is not obstructed or it's not bent. It's clear and the person should technically be able to breathe. However, in the scenario where the person is not breathing, then there's usually something obstructing their airway. Or if you see anything obstructing their airway, like a piece of their breakfast from earlier or any vomit, what you want to do is put them to the side, take 2 fingers out, and swipe out any kind of vomit or aspiration that is stuck inside of their mouth. Now, I know some of you may be thinking, gee, I don't want to touch someone's mouth when there's vomit or anything gross inside of their mouth, right? That's going in some of your minds, but what you want to remember is you have the social responsibility. When you have the power to save someone's life, you should be trying to save that life. And alongside that, any sense of or feeling of disgust you're getting by touching what's in their mouth is going to be far less than the feeling of joy and satisfaction you will be feeling when you save someone's life. I've seen personally the smile on people's faces after they've rescued a person from cardiac arrest. It's something that's indescribable, that you can only know by feeling it yourself. So that's why don't worry about the disgust or any negative emotions at the time, but try to think about the huge amount of positive emotions you'll feel after you've made sure this person is safe and will survive. So that leads me to my next step. After opening the airway and making sure that it is clear, you want to then check for their breathing. So how do you see the person's breathing? On their neck, there's something known as the carotid artery, which is right here, and you should place your hand on their carotid artery and feel it for 5 seconds. 1, 2, 3, 4, 5. So I hope all of you felt a pulse just now on your carotid artery. That means your hearts are pumping blood efficiently. But for my friend over here, the victim, his carotid artery is not, I don't sense any pulse from it. That means that blood is not flowing through their body. And there's something wrong with their heart. That means they require chest compressions. A vital part of CPR that is done so that blood can keep flowing through the body. And you're manually assisting them by pumping that blood for them. So now we begin chest compressions. I'd advise that you take off the person's clothes because later on you'll also need to have an AED that requires bare skin contact. So you should take off the top part of their clothes. And you need to locate the sternum. So where is the sternum of the body? This is the sternum area. It's the hard bone on their body that you can press down on and not worry about usually breaking anything. So you should find the lower end of the sternum near the thorax, and that's where you have to press down on while doing the chest compressions. So how do you press down onto their chest for the compressions? You have to take the heel of your hand. 1 second, I'll take my laser off. It's hard to do compressions with this on. You want to take the heel of your hand and interlock it with your other hand and place it onto the area I just told you, near the sternum. So how many compressions do you want to do? You want to complete 30 compressions, and then you should move on to the next step. So how fast should those 30 compressions be? You want to do these 30 compressions at a rate of 100 to 120 beats per minute. So 30 compressions at the speed of 100 to 120 beats per minute. Like this, I'll demonstrate. So actually one more thing, on the dummy there's a light indicator that should show that if you're doing your compressions properly. If it is showing that it's red, that means you're doing them too slow or not hard enough or deep enough. And if it is flashing red, that means you're doing the compressions too fast. What you want to have is a solid green light. That indicates that you're doing your compressions perfectly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Notice that while I was giving compressions, I made sure that my elbows are straight. That is the ideal posture when giving compressions because you don't want to bend your elbows when you're giving these chest compressions. That's not doing them properly. Your elbows should always stay straight while performing chest compressions. So there's another step that you do after chest compressions, and that is known as rescue breaths. So how do you do a rescue breath? You want to first open the airway again like I showed earlier by placing a hand on the forehead and then placing another hand under their chin and then opening the airway. And then now you want to make mouth-to-mouth contact with them. And you want to blow air into their mouth so that it can fill their lungs and they can use it for their bodily processes, like this. So when you're giving the breaths, you want to make sure each breath lasts 2 to 3 seconds, and you want to do 2 breaths. So after 30 compressions, you want to do 2 rescue breaths. 30 compressions, then 2 rescue breaths. And notice while I'm giving the breaths, the chest is rising. That is an indicator that you're giving proper breaths. Because when the chest rises, it means the lungs have filled with oxygen. So that's how you know your breaths have been successful. So after I've done 30 compressions in 2 breaths, I want to then resume another 30 compressions and 2 breaths in that cycle until either 2 things happen. An AED is given to me, or the ambulance has arrived and they can take it from here. So in my scenario, Shubhan has gotten me an AED. So how do I use the AED? On the AED, there are visual instructions on the pads as to how to use them. So the first pad that I'm going to show you is the one that's going to go on the chest. So visually it shows on the adult that you need to place this pad onto their chest, near their pectorals, right here. And then the other one should be placed near their ribs. And it's visually shown over here too. So after placing them, it's going to look something like this. Now, depending on which AED you have, it may change, but at least usually the AED will instruct you to place them somewhat like this. So after doing so, you're going to then turn the AED on. Or should I just explain to them how to do it? It's fine. So after turning the AED on, it will advise you to put the pads on, but you can also do it before. It does not really matter. But when you're putting the pads on, you want to make sure that you have bare skin contact, meaning there can't be any clothing on the person at all before placing the pads. Now, for girls, that also means you're going to take off the girl's brassiere or sports bra or any kind of breast coverage they have. So I know that may feel a little bit embarrassing and you don't want any kind of boy to see your bare breasts, but this one's also for the boys. You have to remember, you're trying to save their lives. So you should not think about any kind of embarrassment or what they will think after, because they will probably say thank you and they will congratulate you for saving their life. And they wouldn't worry about you seeing their exposed breasts. So always prioritize the chest compressions and don't worry about anything else while you're putting the AED on and doing CPR. Make sure that there's bare skin contact. So then, after there's bare skin contact and you've placed the pads, you want to then let the AED analyze the victim. It's going to analyze their heartbeat to see if it's irregular or not. So after analyzing it, in our situation, it's decided that the heartbeat is irregular. A shock is going to be advised. So the AED will then tell you to clear the person, and that is the key word, clear. So after the AED tells you to clear the person, and it's going to say shock should be administered, there's going to be a flashing red button right here that has a lightning bolt on it, and this is the button you will click when you are actually shocking the person. So before you press that button, you want to yell clear, so everybody moves away from the victim, because if anyone is touching the patient or the victim, the shock might get into their body too. And that's not something you want to happen. So before pressing the flashing red button, you want to yell clear and move away from the person while the shock is being administered. Afterwards, the AED will instruct you to continue with chest compressions and rescue breaths until it either advises another shock or emergency services arrive to further help the victim. So that is the DRSABCD method, the method you should use when you're responding to an emergency situation where you believe the victim has gone through cardiac arrest. Thank you.